And welcome to the COVID-19 Task Force update for Tuesday, the 24th of March. And today we'll speak to Lloyd Phillips as we normally do. Lisa Westaway will also be here. And from the Mohawk Council of Kahnawake, Ratsénhaienhs, Harry Rice will be joining us in just a second. As always, there's plenty to talk about. We'll not waste any time. Lloyd, if you're all set to go, we'll get rolling with today's report as, again, always developments here on the scene.
Thank you very much, Joe. Welcome once again, everybody, for a daily briefing. Today, as has been for the past couple of weeks, has been a very busy day here at the Emergency Operations Center, working along with the Kahnawake COVID-19 Task Force. Today, what we had concentrated on was following up on some of the directives from yesterday regarding the closure of non-essential businesses. So we have posted just a few minutes ago on Kahnawake 911 a communique, a press release, along with a link to where outlines not only for businesses what are deemed to be essential, but also for organizations. What are the essential services in the community for MCK and other entities in the community? So I think it's a good read on there to see what we deem to be essential services. The list is fairly extensive, but going through it quickly, we also realize that there are a few businesses in the community who are kind of in a gray zone, and we'll be doing some further look at that tomorrow on what should be the appropriate decision for certain businesses who are not quite clear cut. One thing I also want to emphasize again, and I know it's somewhat contentious to certain people, but we are not banning the sale of alcohol in the community. It was discussed by the task force on a couple of occasions, and we felt that at this time it's best to keep it status quo as it has been for a while in our community, because we are trying our best to say let people stay as much as possible inside the community, and if there is alcohol sales outside the community allowed, and then people would be more inclined to leave in the territory to go pick up whatever supplies they want. Now, and to be honest, I mean, there's nothing wrong with having a few drinks at home, having a bottle of wine with supper, so we don't want to eliminate that from people. So I just want to make that point a little bit clearer. Today was also a day we're starting to focus on next steps. A lot of strong measures, unfortunately, had to be done over the past couple of weeks, but now we're looking forward to some next steps in terms of enhancing the emergency food services in the community, which is being headed by KSCS. They'll have a full update on that tomorrow. We're also looking forward, in case is needed, options in our community for long-term storage, also stuff in terms of isolation rooms for families or individuals if that is a requirement. So we're trying to be ahead of what's happening. Some of these plans that we're talking about, some of these things that we're doing, we hope we never have to implement, but if we're down that road, we certainly want to be ready to react if the time comes. Matter of fact, some of the things that we had to do in the past week or so, 2 weeks ago, it wasn't anticipated. So we're trying to keep ahead of everything, and we're planning, again, to ensure we're ready to respond if that need arises. I want to make one notation. I know there's some people right now listening from Ratsénhaienhs, and we did receive a request for support. They wanted some of our Kahnawake paramedics to go up there to assist with their service, as well as some Kahnawake peacekeepers, and also looking for some personal protective equipment, what we could spare to send up there to assist them. The request was taken seriously. It was discussed with the fire brigade, with the peacekeepers, and with amongst the task force. And unfortunately, we had to deny the request. It's not something that was taken lightly. We understand the situation in Ratsénhaienhs is similar to Kahnawake, but we are also dealing with a crisis here in our community. And what the resources we have here are stretched as is, and unfortunately at this point we don't have the ability. Actually, matter of fact, as we speak right now, we have 7 peacekeepers who are in self-isolation, have no symptoms, luckily, but still they are following the appropriate rules that are put forward. And also regarding the personal protective equipment that was requested, we are also having a shortage. We are trying our best to secure what we need for our community. We're good for the short term, but unfortunately at this point in time, we don't have any that we're able to spare. So my heart's with you, Ratsénhaienhs, and we're doing our best to get through this all together. I wish I had a more favorable response for you. We have a couple of more speakers to come up after me, but I just wanted to make a notation that we do get a lot of questions at the task force that are medical in nature, asking very specific medical type questions. We are taking note of those. Certainly, I'm not a medical doctor, but we will be forwarding these questions over to a medical doctor to be able to assess individual cases. And in a day or two, we'll be having a more of a Q&A type session where we had questions that were posed to us. We'll have them responded to either directly by a physician, or myself or Lisa will relay the words directly from the physician to the community. Let's say for one example, we had a call from somebody saying, I am over 70 years old, should I take in extra measures, or should I have any extra concerns? And if I start having symptoms, should I be more concerned than, say, somebody who's 40? Well, anybody over 70, for example, is at higher risk of having complications from COVID-19. So somebody in that age category, for example, should be extra vigilant, should be making sure they're really maximizing social distancing, minimizing any interactions outside their home and so on. So I think that's one partial answer. And if you do have any symptoms, I would certainly say pick up the phone, call 811, give them your full background, understanding of your individual case, and they can direct you in the appropriate way. But if you're in that vulnerable population, everybody should be vigilant, everybody should be social distancing, everybody should be following the directives. But if you're in that age category, maybe you should take that one step more to make sure that you're protecting yourself and your family. So with that, that's my report for today. I have Chief Harry Rice from MCK coming up next, and he'll give you some updates as well. Thank you very much.
Okay, thank you, Lloyd. And just a little further information in terms of our elders. Remember, as we say, leave them. They need to be by themselves. However, check in on them, call them every day. Don't make any assumptions. Yeah, they may be perfectly healthy, but sometimes just that contact is all they need. But again, check in on your elders, even though you can't necessarily visit them. That's very, very, very important. In the meantime, Harry Rice, our Ratsénhaienhs Harry Rice, is here. He's got some news and some updates, and we welcome him to the program.
Thank you, Joe. Thank you, Lloyd. My sister made this. A couple of updates from Chief and Council. One is about the task force. Chief and Council knows how tirelessly the task force is working, and we give them full support and confidence on the job that they're doing at hand. With that being said, big news is going to be coming out tomorrow. The executive team and the chiefs will be passing some measures that will give some comfort and calmness and stability to the community. These measures will be put in place to provide some income security and basic needs such as food and water. I just wanted to let the community know that this is in the works. A lot more details will come out tomorrow once it's passed. The chiefs, we want to let the community know that although the pandemic is going on, chiefs are still working on other projects and concerns not linked to the coronavirus. Chiefs can still be reached through the number at council, where the receptionist will get in touch with your favorite chief, and then in turn will reach back to you in a timely manner. Also, our neighboring communities have been in contact with MCK and praising the work of the COVID-19 task force. MCK has kept an open line and will continue nation-to-nation relationship with our neighbors. That's about all I got for update. Personal note, it is hard, the situation. I don't think anybody has ever encountered anything like this in their lifetime. Please, let's not panic. We're all in this together as a community. Like Joe said, check up on mom and dad and Baba and Dura. Ask if they need supplies. If they do, deliver them, but just leave them on the porch for them. These are our most important people in our community, them and our children. We have to take care of them. So take care of yourself, use all measures put in place, and respect one another's personal space. Now go on.
No, very well said, Harry. All right, so with our final update today, we welcome once again the Executive Director of the Kateri Memorial Hospital Center, who also happens to be the spokesperson for the KMHC, Lisa Westaway.
Good afternoon. So today I'd like to give you an update on a few different things. Sometimes it's in response to things that I've seen on Facebook, but mostly to give you some updates about KMHC firstly. So for the community as a whole, we have 5 total cases of positive COVID-19. These are not all in the hospital. These are also cases in the community. So what this tells us, and I think it's important to mention, is that we haven't been able to identify the source. Therefore, as we have explained in different presentations, that is a sign of community transmission. So what that tells us is that there are many people who are COVID-19 positive, and that we all really should be taking precautionary measures, social distancing, self-isolation, staying in our homes as much as possible. Since the information came out yesterday, I've been a little disappointed actually of some of the things that I've been seeing going around, and I just want to correct maybe some misperceptions or misinformation. So yesterday I did see a lot of posts, a lot of people trying to pinpoint whose fault this is, who's the first person, a lot of shame and blame and negativity with respect to what's happening. I want to remind everybody that this is a flu. This is a virus that is easily transmissible. It was across the world. This is a health pandemic that is that is definitely going to be here no matter what we do. There is nobody responsible. There is no one to blame. We only have the control of each of our individual cells to help stop transmitting as much as possible. But if we start going down that road of blame and negativity and shaming, then it's going to be very difficult to put our energies where they should be, which is in working with each other, in educating each other, and in the positivity that we need to get through this. So I just wanted to mention that because I know we're putting so much emphasis on COVID-19. We're talking about it, we hear about it day in and day out. And as Dr. Godse reminded me today, even though it's all around us, we need to take time in our day for something other than COVID-19. We need to take time away from Facebook, take time with our family, take time for positive things so that it's not consuming our thoughts and our energies. For outpatient services, yesterday we closed our doors. The reason why we closed our doors so quickly was because when we found out that we had positive cases, we needed to do a thorough investigation to really understand the extent of the contacts within the hospital and the possible impact to the community. Today I can very safely say that we can reopen our doors tomorrow. So we've had discussions and investigation done with Dr. Gotse, with Public Health, where we are certain that our environment is safe. So we're opening our doors with the restricted capacity that we already had. So as you know, before coming in, you need to have an appointment. We will screen you over the telephone. You'll also have a telephone consultation with a physician or a nurse where we'll decide whether you should be coming in through our doors. We still will not accept anybody who has traveled or who has been in contact with a COVID-19 case or is suspect, but we will be providing you assistance and orienting you to the right place if that is the case. Otherwise, we'll be giving you an appointment at KMHC. It's important that you don't shun the hospital in a sense, because there were 2 cases. The hospital is a safe place to be, and in fact it is probably one of the safest places to be in the community. So we forget that and we think, well, there was a positive case, we shouldn't be there within the walls, but in fact I just want to remind you there are cases everywhere. So the idea is, no matter where you go, if you have to go out, no matter what you do, that you maintain your social distancing, that you maintain your safety procedures, that you wash your hands, that you wash the things that you touch. Those are all the elements that you need to keep in place no matter where you go or what you do. I just want to talk a little bit about the safety in the hospital for our employees, because we get a lot of questions from employees, not many, but mostly from the community. And the question is, well, are they taking care of their employees? What's happening there? When each employee that's hired at KMHC does receive an orientation in infection and prevention control, so we do have an infection prevention control specialist, and we also have a staff health nurse. So there's a lot of education also about protective measures, hand hygiene, how germs are shared, droplet versus airborne transmission, how to wear protective equipment depending on different types of transmission of viruses and levels of transmission. We also have specific rules in place right now as we speak with respect to uniforms. So all of our clinical staff actually change their clothes when they come in. They change their clothes when they leave. They bring their clothes home that they wore and they wash them. We also provide special fit testing. This is a special testing for each individual employee, so that the special mask that they need when they're doing procedures with someone who has the COVID-19, for example, so that the mask fits them perfectly. There's routine training also for housekeepers with respect to cleaning on special high-touch and low-touch areas. So it's just, basically infection prevention control is everybody's business. And we're really proud at KMHC we have one of the lowest infection control rates in our inpatient care. And just as an example, earlier this year we had 1 case of gastro in our inpatient ward, and 1 case is considered an outbreak. And so all the measures are implemented with respect to housekeeping and PABs and nursing all across the board, and actually there was no transmission of gastro within inpatient. And we all know how much that gastro can be transmitted, how easily it can be transmitted. So I just wanted to give a little bit of an update, not only to talk about how safe our employees are, but also to let you know that the hospital is a safe place to be. And in fact, if you need a doctor's appointment, I really urge you to contact us so that we can assess your case either over the phone or in person, rather than you going to an emergency room or another walk-in clinic where we, I would like to think that our hospital it's safer for you to stay within the community right now. So I just wanted to kind of ease your conscience about that a little bit. So I'm gonna, I guess daily we'll talk about the number of cases. That's something that we're committed to do. I may not have all the most up-to-date information when I come to this live update, but we'll be as transparent as we can with the information that we have at the time that we present to you. And again, I just want to go back to my first comment: is let's really work together. This is not an embarrassment. This is a virus, but we have a responsibility to control the transmission of the virus, but we are not responsible when we catch the virus. So because right now the virus is around us, and so we just have to take all the measures possible to protect ourselves and protect our elders, protect those around us. So thank you. See you tomorrow.
All right, now Lisa, and just a word, now that you know that there are more cases in Kahnawake. We're not alone. In Quebec, for example, it just came out that there are now over 1,000 cases. So another threshold has been reached. So it does get tough. Lisa said something I think important. When the blame game seems to be one of those things that happens, and you know, a certain person may have had COVID-19 and brought it. Got to stay away from that. You know, think of it this way: you don't know if you have it, and you could be one of the people who are complaining on Facebook and saying all kind of nasty things. And what happens if you find out, I didn't know I had it? Are you going to start yelling at yourself? It's not about yelling and blaming. It's about doing whatever you can to help this situation by doing all of the things that we've been saying over the past 2 weeks now and more. You know, the social distancing is such an important thing. And if you're in isolation, you're supposed to be self-isolation, do it. Stay in the house. You know, others, if you're healthy and you want to go for a walk, that's great. I do this all the time with my wife, but we make sure we're separated from other people. So take all of the necessary precautions. That's what really we need to do. I know that public safety has been receiving a lot of phone calls. They're acting as a conduit. People are just calling and asking information. So once again, the number at the Public Safety Division here is 450-632-0635. That's 632-0635. They will, if need be, forward your messages or your concerns to the right people, but they are acting as a conduit right now, so I would like to get that message to you. And once again, if we cannot stop the virus from coming, but working as a community, we can limit its impact. So everybody just do your part, and we'll be back tomorrow with an update, hopefully with better news than today. We hope that at a certain point we start turning the corner, but it's not over yet. We all have to stay and work together. So take care of yourselves, take care of each other, and we'll see you tomorrow. Thanks a lot for watching.